Taking a live look outside this morning, another hazy morning. Wildfire smoke still blowing in from the north, and it could really have an impact on our health.
Our health expert, Dr. Payal Kohli, joins us this morning. And Dr. Kohli, I mean, this has been a problem right now for the past few days. I was trying to take my dogs for a walk yesterday. I didn't know how long I should even let them be outside. How do we know if this wildfire smoke is impacting our health?
So it's all dependent on dose, Jordan. So, think about firefighters, they're right next to the flames themselves. They could even get carbon monoxide poisoning. But for most of us that are sort of distant from the fire itself, symptoms are the biggest giveaway. Runny nose, scratchy throat, irritated eyes, which at this time of year could also mean allergies.
Yeah.
Yes.
But certainly if you have any kind of skin irritation, because if you think about the smoke, it's going right into your nose, irritating your nose, then you inhale it into your lungs, it irritates those lungs. All the passages lining the airways are full of inflammation. Now, what smoke can also do is also can affect your ability to fight cold. So if you're noticing that you're getting a lot of infections, respiratory infections, more so than usual for you, that may also be a sign that your exposure is a little bit high.
How interesting. What about the long-term impacts of this?
We try to hope that it's just short-term, limited to the exposure, but we do know, mostly from firefighters actually, that long-term smoke exposure can actually impact our longevity. It can impact our lifespan.
Yeah.
And so firefighters, they say, can have 10 years less of life as a result of their exposure. Some of the rest of us, perhaps the estimates are closer to 2 years, but that's really kind of chronic exposure. And we don't know if it's the exposure directly that's causing sort of accelerated aging of our cells, or it's the fact that it increases our risk for conditions like stroke and heart disease and cancer and kind of other downstream effects that could affect our lifespan.
And nobody in this area is able to escape that wildfire smoke right now. If you step outside, you're getting a pretty big, breath of that. Who is most at risk, though, whenever they breathe that in?
Yeah, so as you said, we're sort of all at risk, but there are people who I would say are extremely susceptible that should very much avoid getting a dose or stepping outside at these types of times. So the extremes of age. So I'm talking about our young kids because their lungs are actually developing. So if you take your kid to the park and there's this kind of smoke outside, you can actually increase the risk of getting asthma by about 2-fold by exposing them to this type of wildfire smoke. Similarly, older people, they have very little lung reserve. And so if you expose them to this type of smoke, especially, when they don't have much lung tissue as a backup, you can really accelerate onset of disease. Anyone who has pre-existing heart disease or lung disease should certainly be very careful. And then pregnant women is the other one that's really big. And that's, of course, exposure to mom, but also potential exposure to developing baby as well.
Oh man, I had my kiddos out all day yesterday. Okay. Is there any difference between this Canadian wildfire smoke that we're getting than what we would get maybe in Colorado from wildfires?
Yeah, that's a really good point. So pollution really depends on the particulate matter. And so it's the size of the particulate matter. And if you think about farther away fires, the particulate matters that travel are probably smaller than the ones that are closer to us. And we also, if we're very close to the fire, get exposed to more some of the other irritants that are present in the smoke rather than just the particulate matter. So there are differences, I would say, but some argue that small particulate matter getting deep into our lungs can actually be potentially more harmful than some of those larger pieces that we can kind of cough out or clear out with our mucus.
So help us out here, because we do live in Colorado, and the example that I gave that I was trying to walk my dogs yesterday, that's pretty common for a lot of people, or Corey with her young kids out there. You can't keep them inside all day. If we do have to step outside, what are ways we can minimize our risk?
Yeah, so I would say limit the time that you're outside. That's probably important. Limit what you're doing outside. So it's not a good time to run outside right now, because then you're taking in big breaths of air and really inhaling that smoke.
I was going to go for a really long run too.
The N95 and the N100s can actually filter a lot of that particulate matter. So especially if you're someone who's susceptible to, this kind of pollution or potentially have lung disease, that may be a good thing to wear. If you're inside, you can actually use HEPA filters. So if you have a filtration system that has a HEPA filter, that will help filter out, many of those smokes. And then listen to Ed. If he tells you that the air quality is poor or what time it's going to be poor, sort of try to time your dog walks around when that air quality is the worst or when it's the best.
You just got us in so much trouble, because now his head so big.
Like I told you so. We always have to listen to Ed. Well, really great points and tips this morning. Appreciate you coming in. I guess I got to keep my kids inside, Ed. That's so hard. They just need to burn off the energy.